Oh, snap!
The world is finally waking up to the crap that's baked into and sprayed on kibble dog food. No longer can commercial pet food manufacturers fool us with pretty pictures and false promises. This is the raw dog food truth. The view and opinions expressed on this podcast are not intended to replace medical advice. Before starting any raw diet, do research, ask lots of questions, and consult your vet.
Well, hello, raw feeders. I'm Dee Dee Mercer-Moffat, CEO of Raw Dog Food and Company, where your pet's health, yes, even raw, is our business. And we're friends like my friend, Dr. Judy Jasek. Well, she doesn't feed kibble and she doesn't scare people about the avian freaking flu. I'm so tired of hearing about it, Dr. Jasek.
Yeah, I know. People keep cooking their raw. I said, what for? No, I'm not worried about it. They ask me if I'm worried about it. I say, no, not worried about it.
You know what? I remember, I think we've said this on every podcast, the dilated cardiomyopathy thing, right? And there was no change in people's minds about, oh my goodness, my dog has this, dilated cardiomyopathy because I've been feeding them raw and they don't have grains in their food. And they just believed that. They just ran with it, which caused Keto Pet to have the, bring the lawsuit. And I just, I don't get it. I was listening to Robert Kennedy Jr. on Hannity the other night. And, he basically said, look, you're not going to get it from food, and he also said, don't vaccinate the chickens. You don't want to be vaccinating chickens. It's going to cause a problem. He said, and stop killing them. We need to figure out why the ones survive and why the ones don't. Right. But no, they're just going in and killing them and doing all this kind of stuff. Now, I kind of felt like he was walking the line. He didn't want to be hated right off the bat. But anyway,
he's got to be a politician a little bit.
He's yeah. Mm-hmm. What is Joe Salatin saying on this bird flu BS?
He says, so he's not in the necessarily viruses don't exist camp, but he thinks that it is a lot of fear propaganda and that they're going about it the whole wrong way. Is that if even say it were a virus and there were chickens dying, he says all along, like regardless of what condition you're dealing with, chickens, any livestock, any food production animals, they get sick because of the management, not because of the viruses. So he has always contended, no matter what you're dealing with, whether it's a virus, bacteria, a parasite, it can all be corrected through proper management. And that's what he's done. That's why I've always had such respect for him, because if something would happen in his animals, it wasn't like, what drug do I need to use? What vaccine do I need to use? He's always taken the approach of, what do I need to do differently? What am I doing wrong here that my animals have gotten sick? And he didn't have vet bills. He doesn't call the vet. I mean, sometimes you have to call animals that get sick or injured, that's sure part of raising production animals. But his take is that if you have birds getting sick, you eliminate those. The ones that are strong and healthy, you let them live, because they're the ones that are going to be, if there is something out there causing a problem, they're going to be immune to it. Those are the most robust individuals. And if it's something that's like, that the chickens are transmitting, back and forth, how does it end up in the food? How does it magically end up in the meat? I was taught in vet school, that was one of the big principles we were taught, that viruses do not typically cross species lines. Now they're saying that bird flu can jump to cows, can jump to cats, can jump to people, so it just creates a whole lot more fear. But from a management perspective, you don't go get rid of all the healthy birds. You want to keep those and keep breeding those and just get rid of the sick ones. And that's what makes sense from a management perspective. But I believe, of course, there's another agenda here is having a negative impact on the food supply and harming the small producers, because it wipes out a small farmer, with a small chicken farmer might have 5,000 birds or something. That's small compared to hundreds of thousands of birds. But you go and take out their whole flock. That's hard for them to come back from that.
Yeah. There's still so much scary propaganda going on out there. And listen, you guys want to cook your raw food? Be our guest. Go right ahead. Cook it. I can't tell you how many people love the farmer's dog. And I say this on every podcast. And they're like, yeah, my dog has UTIs. Yeah, my dog is fat. And I'm like, but they don't have the bird flu. That's what they think. And I'm like, okay. I don't know. I don't know. But I think that again, what you and I were talking about prior to the podcast, you can damage people's reputation so easily. You can damage the raw feeders or the raw producers so easily by issuing a recall and then saying, oops, sorry, we were wrong. Right? Because the oops, sorry, I'm wrong doesn't get out into the public. Right? But what gets out into the public is, oh, there's a recall, right? Because we get asked that all the time. Have you guys had a recall? Has any of your food ever been recalled? Yeah. Yeah. Remember years ago. And you start figuring the game out. It's crazy what the game is. And yet you can have dead dogs in the kibble industry, lots of dead dogs, and they don't make a big deal out of it. Right. Hell, they won't even recall it.
Because they're not creating fear. Fear is such a powerful emotion that as soon as the media creates fear around a topic, it doesn't go away. Yeah, there's been so many more recalls in the kibble industry than in the raw industry, but it's just like, okay, such and such happened. Now it's been fixed. Let's go on our merry way. And they don't make a big deal about it. So people don't make a big deal, but create fear around bird flu or raw feeding, which they've been trying to do for a very long time. It's just the topic du jour. It used to be the cardiomyopathy. Now it's the bird flu. They'll always have a thing to keep people afraid of feeding raw. And that fear is such a powerful emotion that once people lock onto that, I think it's really hard to change. It's really, when people are really afraid of something, it's really hard to change their mind about it. And that's intentional, in my opinion. Yeah. They want to create this fear. They want to create skepticism against the raw feeding, because there's big, huge companies that make a grundle of money, feeding these crappy kibbles.
Yeah. I mean, you really do have to have balls, big balls, to stand up to the fear. Now, speaking of balls, we do have a question about the prostrate. That's the same thing, actually, right? Balls and the prostrate, it's not the same thing.
Not the same thing.
It's not the same thing, but they're in the same vicinity.
Same area. They happen in boys. They occur in boys. And yeah. The testicles are the ones that make the sperm that allow boys to make other, baby boys.
Yeah.
Prostate's the gland that kind of helps, influence the show.
Yeah, there you go. All right. So we do have a question from Katie. She's going to ask about dog's prostate, and specifically BPH or prostatic cyst. Okay. And she does listen to the podcast. She loves you too, Dr. Jasek. And she just wants to understand really what to do with her dog's prostate issues. She says that traditional vets who want to give medication or do surgery are not helpful. But she also doesn't want to lose her dog to prostate issues. He's not a candidate for surgery, by the way, as he has a bleeding disorder. Ooh, a bleed. Does that mean like he's got non-coagulation?
Probably a clotting disorder, if I had to guess. Yeah. That his blood does not clot. Do you know, did she say if he's neutered or not?
No, in this particular information, I do not know. So can we talk about neuter versus non-neuter?
Yep. Yep.
Okay.
So if in neutered dogs, well, let's start with unneutered dogs. So unneutered dogs, intact dogs, because of the testosterone, they're a little bit more prone to having enlarged prostate. Now, it also depends on the age of the dog. So if you have an older dog, say a dog 10 years or older, that's not neutered, be kind of normal for their prostate to be a little bit enlarged. And then it wouldn't be concerning unless they were symptomatic. So the prostate sits kind of between the bladder and the colon. So the two things that can happen that tell you that enlarged prostate is a problem is if they're straining to pee, like they're going like taking a long time and they're just getting like, little dribbles out or blood in the pee, or they got flat poops. So the poops come out and the prostate side just squishes them and they get the ribbon poops. So those two things
Wow.
can happen if the prostate is enlarged. In an older dog, if the prostate's enlarged and they're not having any of those symptoms, it may not even be an issue. If we're having symptoms, and this used to be what I was taught in school, is that if you don't neuter dogs, this was one of the big pushes to have male dogs neutered, that they're going to end up with some sort of prostate problems, before, or they'll get to a certain age and they're going to have prostate problems. That's one of the reasons to neuter them. And that has turned out, not to be true.
Uh-oh,
So
wait. That turned out not to be true. Come on, Dr.
yeah, it
Jasek.
turned out.
Things like that happens? Okay, sorry. I
We're
digress.
taught the wrong thing in medical school. An untruth. It's sad. It's you get to a point in your career and you're like, man, probably pretty much everything I was taught was wrong, except for like, here's a bone, here's an artery, here's a muscle, the anatomy, the physical stuff, all the other stuff. Yeah, unfortunately.
Sorry. Okay, I
It's
digress.
okay. Anyway, so that's in prostate enlargement. Now you can get cysts, which can be benign. They just get like little fluid-filled cysts on the prostate. And same thing, they may not be problematic unless they're causing one of these other symptoms. You can get tumors of the prostate that usually the problem with that is, again, the enlargement causing problems urinating, problems defecating. Now, if an older dog starts to have these conditions and they're not neutered, they can be neutered, and the lower testosterone, a lot of times that helps. If the dog is already neutered, I would say an enlarged prostatic cyst would be pretty unusual unless something else got to be out of balance. So then I'd be looking at, okay, what's out of whack in the endocrine system? Is the diet balanced? Do we have a really good balanced diet? I like to make sure they're getting enough organ. Like even I always like to add a little extra organ in above that 10%, make sure they're getting all those nutrients, maybe even feeding some testicles and things like that, because you're getting those nutrients that are not there in the body, if the dog is neutered. So I'm really scrutinizing the diet. I think that's super important. And then I would be looking at other endocrine issues. Is the thyroid healthy? Are the adrenals healthy? Do we have what other symptoms? Because in my opinion, for an unneutered male dog to have like benign, the BPH, benign prostatic hypertrophy, which is just a big word, it means prostate's big, or a benign cyst, something's out of balance in the body. We got to really look at that. Now, cancer also indicates imbalance, toxicity, those sorts of things. So I guess it's, I kind of look at it like there's going to be in each pet, there's going to be an area of the body where symptoms develop if there's an imbalance, if the diet is out of balance. Some pets, it might be the skin, some might be the poop, some pets might vomit. You just don't know. In male dogs, it can show up in the reproductive system, but it's still a sign of some sort of imbalance and or toxicity. Remember that the kidneys are an organ of elimination. So are we feeding clean water? Is your dog's drinking water clean, filtered, not from the city where it's got all the chemicals in it. They're not out there breathing up glyphosate. We want to make sure, because if any of those toxins are ending up in the kidneys to be eliminated, well, that's coming out in the urine. That's exposing the prostate to those toxins. So I think it's in some individuals, it's going to be the part of the body where the symptoms of imbalance, toxicity, nutritional imbalances show up. So we just got to look at balancing all those different things out.
Now, I don't know what Katie's feeding. From what I can tell, I'm not sure that Katie's a customer of ours. So just for you listeners, know that we do help you guys out on how to feed raw, even if you're not one of our customers, although we would appreciate it and love if you were. But I don't really know what Katie is feeding. Don't know how old the dog is. We definitely will send this podcast to her and see what other questions she comes up with. But Dr. Jasek, how does she? So you're saying, I wonder how she even knows about these prostatic cysts. Is that something that is just found on a routine exam? Or are you saying that she might have noticed it from, like you said, flat poops or other types of things? Or how would she even know this?
The most common way is blood in the pee. Like, dog gets blood in the pee and they go in and then they're checked. But there would probably be, yeah, she wouldn't be able to see this externally. There would have had to been some symptoms she went in. Now you can feel the prostate digitally. So you're doing a rectal exam with your finger. We can only feel part of it, but you can feel if it's enlarged. But really the most thorough way is to do an ultrasound. We do an ultrasound of the abdomen, then you can look at the prostate, the kidneys, and you can evaluate, because there could be, like, the prostate could be enlarged, further in where you can't feel it, so that the imaging wouldn't necessarily show up on x-rays. It might, but it's a little harder to see because you got the colon there. If the colon's got a bunch of poop in it, you might not see it. So doing the ultrasound would really be the way to go. So I would suspect she's had something like that done. Now, if she hasn't, I'd suggest she get that confirmed, because sometimes veterinarians like to guess and do what I would call presumptive diagnosis. Oh, your dog's such and such an age. Say he's a 10-year-old dog that's not neutered, got blood in the pee. They might say, oh, he's probably got enlarged prostate or something, even if it hasn't been checked out. So if she hasn't had that kind of testing done to confirm what's going on, I would definitely recommend that.
Okay, so a dog that's been neutered would not have this issue.
It would be really unusual. It would be really unusual.
Okay, gotcha. Is there anything? I think that definitely you talked about the diet, right? You can definitely make sure that the diet is correct. Have you seen where the cysts are actually where they actually dissolve or go back into the body once you get the diet right? Once you kind of correct some of these other things, can they be rectified through other means than medication and surgery? I guess is the question.
Yeah, I mean, they can be. I mean, you may not, like, say, in the case of the cyst, you might always see that there was something there, but maybe we can get it to shrink down, keep it from progressing. I always look when I start to work with a patient and what they have going on, and I look at how it's affecting their quality of life. And I always ask the question, okay, and this enters in a lot in cancer patients. If we can stop this from progressing right now, can this pet live with it and have a good quality of life? And because if the answer to that's yes, then that feels much more doable. Then we got to make this complete. Our only parameter of success is we've got to make this completely go away. Well, that might be harder to do, but if we can make it something that the pet can live with and live with it comfortably, then that is very doable, because things do happen to the body. We live in toxic worlds. A lot of dogs also are rescued, they're adopted. That's another question. How long of this pet's history do we know? Has she had the pet since he was 8 weeks old? Or if he was adopted when he was an adult, then there's a whole early history there we don't know anything about that could also be playing a role. previous injuries. Was he, hit by a car, or hit by a horse, or who knows? It could have traumatized that part of the body. And there's so many things that can enter into that that we may not know. So I think if we look at it from that perspective about maintaining quality of life, then yeah, I think it's very doable.
Yeah. And if the dog isn't neutered, okay, but you're saying that if it were a dog that didn't have clotting issues, right? So to say, and I, probably, can you get a second opinion on that too? Do you see that dogs actually do have issues? And why would a dog have a clotting issue in the body? I get
That
it,
Yeah,
but
that's kind of like a genetic thing, something they're born with. Like, because there's a whole cascade for blood clotting. Like you have the platelets, which are one of the blood cells that are the initial like first line. Like, you cut your finger or something, after a little bit, the blood starts to clot and hopefully it
mhm.
stops bleeding. But then there's a whole cascade. There's like many, many, many steps that happen to form that solid clot. And it's like enzymes. There can be deficiencies where like one common one is called von Willebrand's disease. It's common in Dobermans. And there's one factor that's necessary in this cascade that they're missing. And so their blood does not clot or takes a lot longer to clot. But I always like to look at what testing has been done, because again, over the years, I've seen a lot of vets make presumptive diagnosis, but there's very distinct clotting tests. There's specific tests you can do to measure clotting time. How long does it take for the blood to clot? So that should be able to be definitively tested, but I would certainly make sure that the right test is done. Now, just say he's intact. He can't have surgery because he's got a blood clotting issue and he's symptomatic. If it were cancer, if it were tumor, that's a little different because we're treating a whole other thing. But say it was a benign process, then I would say, kind of as a last resort, you could do like a hormonal therapy. You do like a progesterone or
Okay.
something like that, which effectively lowers the effects of the testosterone. And I'd still do that as a last resort, but that would not be as toxic as a pharmaceutical. You could take a hormonal approach where you're just kind of changing the hormonal balance a bit. It's kind of the same as neutering. It's just, instead of taking the testosterone away, you're giving more progesterone. So then you're just changing the ratio of the hormones. So
Yeah.
that would be something that could also be an option should the other options not be available to the dog. But we still want to make sure we've got the good healthy foundation, the good diet. We're not giving, same things we always talk about. The vaccines, heartworm, flea and tick, what kind of pharmaceuticals? Are we giving the body any other toxins that could be making it less healthy?
Well, I think that the majority of folks that we talk to that have these issues are already doing those because they probably can't get in to see a vet without them. You know
Oh,
what I'm
the
saying?
vaccines and stuff. Yeah.
I mean, it's yeah. Hopefully that will get better
Mhm.
in this next 4 years. We'll see. I mean, the AVMA, they come out with stuff that's kind of wonder where it's actually coming from sometimes, but
Mhm.
um
I was thinking about that the other day. Like, when we did the rabies webinar and all that, and I thought, we really need to go after these laws. And I'm thinking, and then it got so close to election time and everything. And it's like, well, there's so much turmoil. Like, let's get past the election, who's going to be in there for a while now. This might be the time to pursue that. And if nothing else, like, I think going to the legislature and saying, okay, actually viruses don't exist and we need to just drop all these rabies mandates, that's probably not going to happen. But what if we just, could say, could we allow tighter testing? What if, even if we could change the laws to say, you know, if a pet has antibodies over a certain level, the same level that's required for, for export for pets to travel and all that, can we then exempt them from the vaccine? So they'd still need to have at least one rabies shot, but they're not getting them for the rest of their lives. And I think it would help allow people to get into the vets. The vets then, if we could change the law, shift the law, then the vets wouldn't have that to stand on because that's what they're standing on. It's the state law. I have to require it because it's the state law. Well, then they wouldn't have that to stand on. They'd have to allow a titer testing. And I would say that probably the majority of dogs, if they had even one rabies shot, would probably have a decent titer test. So I think it might be worth revisiting. I might have to look into that.
So the reason that the vets want your dogs to have these rabies shots is for their protection, supposedly. So why don't they just get a rabies shot?
They're supposed to already have them.
But why does the vet not have to take a shot every 3 years?
Because they get titer tests.
Then why can't the dogs have a titer test?
Good question, Dee Dee.
I'm thinking today. I got my thinking cap on. It must be my rooster cup.
Your rooster cup. And it matches your shirt. That's just so awesome.
Yeah. See, this is not fair. It's not fair. I'm sorry.
Well, it doesn't even make any sense. It doesn't even make any sense. They say that veterinarians, because I had rabies shots when I was in school. I was a young pup, didn't know any different, and it was required to stay in school. Like,
did it hurt?
Get them.
Did it hurt?
I don't remember it hurting.
So was it just one shot, or was it like 12 in the stomach, like I've seen on Yellowstone and what my dad had to have?
Those are the post-exposure shots. No, I think it was just two, like one and a booster that you did have to get a booster. But the AVMA said all along, just get your titers checked. You go to the AVMA conference, they have a little station there. You can get your blood drawn, get your titer checked, see if you need a rabies booster. So they recommend it for the veterinarians, but it's not valid for the dog. So what's the difference? It doesn't even make any sense.
Has anyone ever lined up to get another rabies shot? I'm just asking for a friend. Has anyone?
Probably. I bet you anything that if a vet did a titer and it came back low and it said, we would recommend you getting a booster, I bet they get boosters. I don't know where they go to get them for people, but probably the doctor, your human doctor would get it. I don't know.
Okay.
I've certainly never done it, but.
This is a great question for you guys when you go to the vet. Ask them why your dog needs a rabies shot. Is it for their safety? Because this is what they always say, right? And this is what, our daughter who's a vet who says, well, because we can't expose our techs to dogs or anybody that, that might get, rabies. And I'm like, well, aren't you protected? When did we hear this? Aren't you protected? If you got the vaccine, aren't you protected?
Have you asked her that?
Mm-hmm.
If she's had the vaccine? I'm sure she has had the vaccine.
Yeah. Oh, yeah. But it's really weird, I think, for vets who kind of are coming out of that kind of mind, thing.
And out of the trance.
They're coming out of the trance. And they're like, they don't really want to talk about that too much. Right? It's better if we just get the dogs vaccinated.
Right. Because that narrative is a little uncomfortable. I want to stay with the narrative that everybody else is saying, because then I get to stay in the cool kids club and people don't think I'm crazy. And, I don't have to worry about my license and all that stuff. That's comfortable over there. Going with the other narrative, that'd be a stepping outside of my comfort zone. So,
Well, look, getting the rabies shot has so many benefits long term. You're going to get them back in the office. Okay. You're going to get other medications that are needed. They're going to need other kind of health help because of these continued, things, yada, yada, yada. We've said it so many times, we're blue in the face. That is one thing, when people talk to me about, why is your dog so healthy? Why does your dog look so good? Why is it? Well, and then they get this blank stare and they're like, I don't want to talk to you anymore.
Right.
You feed raw and you don't do flea and tick and heartworm.
But the fact that your dog looks so good is not evidence enough to do it.
You're
Right?
like, yes, this is how nonsensical we become. And when you and I talk about that there has been no isolated virus, that falls on deaf ears. But I challenge any of you to go out and look at Christine Massey's work. If the Freedom of Information Act has been presented over and over and over to all these different health agencies, and not a one of them can provide the research that shows that this isolation has happened, and they want to play with this isolation, narrative. They want to play with the wording. And I think that when you really read Christine Massey's work, you will see that she's made it very clear. She uses their words. She can, okay, well then show me this, show me this, show me that. And they can't. So isn't there something wrong with that, Dr. Jasek? I mean, if you were going to buy a house, right? And you said, show me the comps that substantiate the money that I'm going to spend on this house. And they say, I can't provide you with any comps. Just trust me.
Right.
We can understand that for some reason.
Right. Like you wouldn't buy that house.
Right.
Unless you could see that. I think sometimes like information is just too uncomfortable and people just don't want to hear it. So they'd rather just plug their ears because they got to change so much about their way of thinking and how they've been managing their health, managing their pets' health. It's this whole paradigm shift it's just too uncomfortable. So if they just ignore that piece of information, they don't have to make that shift. If they accept that it's true, then they have to make that shift. And for me, I want to know the truth. I don't care what it is or how uncomfortable it is. Like I want to know the truth. I've taken on a lot of new paradigms since COVID, last 4 or 5, 6 years, however long it's been now. I've changed a lot about the way I think about disease and where it comes from. And I feel like I'm much more of an outlier now. Like there's a lot fewer people even in the holistic world, in the viruses don't exist camp. That's an even smaller group. But if something rings true to me, that's what I'm going to follow. Because for me, feeling like I'm following the truth and speaking the truth and telling people what I believe to be true and best for their pets, that's how I sleep at night. I couldn't do it any other way. I don't know how these vets can just stand there and say, well, your pet needs a rabies shot for my protection, even though I've had a vaccine and I can go get a rabies titer and it's valid, but it's not valid for your pet, or I'll do it, but it's going to cost you $1,000. I don't know how those vets can live with themselves because they're just telling a bunch of lies and they're just so bought in to the propaganda and the narrative that they're just okay with that. I don't understand it, but that's the state of things.
Yeah. Well, even if you have a current paradigm, right? Even if you think that something's true at the moment, folks, you can always get a second opinion, even if it makes you uncomfortable, because you have to look at it and say, why does this make me uncomfortable? Is it because doesn't necessarily mean, it's true. And for Katie, I would get over and get a consult with Dr. Jasek if you're not comfortable with what is happening with your dog's prostate. And I think this was a fantastic podcast. We haven't talked about prostate too much, so that's great information. But for all of you, if you're out there and you need a second opinion, you need a different perspective, something is bugging you, your dog's not looking well, not feeling well, The medications don't seem to make sense anymore. I think what you want to do is get over to ahavet.com, ahavet.com, work with Dr. Jasek, and make sure that you're spending your money wisely, right? At the vet. Maybe you don't need to be doing things that you're doing. I don't know. My dog's worth that, worth a second opinion for sure. Get over to Raw Dog Food and Company. You want to get your dog on a species appropriate diet. No bird flu here. Okay. There's bird flu here.
Bird flu not allowed.
And bird flu not allowed. We have a whole page on it on our website, so you can go over there and take a look. If you want to cook your raw, feel free. Okay. All right. But we're here to help you. Brian is there to help you. It's a free consultation. Get over to rawdogfoodandcompany.com, where your pet's health is our business. And what, Dr. Jasek?
Our friends don't leave friends. Let friends feed kibble, y'all.
That's right. We'll see you soon, everybody. Bye-bye.